Hello and welcome all to the Youth Mental Health Conference. We'd first like to begin by acknowledging the traditional owners of the land. We would like to pay our respects to their elders, past, present and emerging. On behalf of the chairperson, Vasan Srinivasan, our patrons and board of directors, I'd like to welcome you all to the Youth Mental Health Conference. National Mental Health Month is an initiative of the Mental Health Foundation Australia to advocate for and raise awareness of Australian mental health. It is an important time where the Australian community comes together to raise awareness that #mental health matters. Throughout this month, many events have been organised in each state of Australia, aiming to attract and unite Australians of all ages and backgrounds to raise awareness of better mental health for all. Today's event, the Youth Mental Health Conference, aims to discuss the Youth Mental Wellbeing Policy Paper to describe common mental health challenges from the perspective of young people, and how the governments, health service providers and educational institutions can provide their services to address these mental health issues with respect to the terms of reference of the Royal Commission into Victoria's mental health system. During 2018 National Mental Health Month, during the 2018 National Mental Health Month, the Mental Health Foundation Australia organised a very successful Youth Mental Health and Wellbeing Conference, bringing together high school students, university students and TAFE students to discuss the mental health challenges their particular demographic faces and the actions needed to be taken in the important area of mental health. The Mental Health Foundation Australia and the MHFA Youth Advisory Committee prepared a policy paper, followed by recommendations based on the reviewing the constructive discussions during the event and the outcome of each workshop. To improve young people's mental health outcomes, it is essential to concurrently innovate and integrate across both education and health systems. And this is what we propose. It is important to take the recommendations of the youth seriously, and it is also time to take the mental health of youth seriously. Let's first begin by watching the Mental Health Foundation Australia's 90-year journey video.
A journey of 1,000 miles begins with a single step. Mental Health Foundation Australia's journey began 90 years ago. It dawned in 1930 with just a founder and vision, which was to reach and impact Victoria. Now we have a presence in all states and changing lives for over 100,000 people throughout Australia. Our organisation's biggest initiative yet is our National Mental Health Month. Our month-long initiative is to advocate and raise awareness on Australian mental health. Our vision is to recharge and educate as many Australians as possible to help reduce stigma and facilitate positive and non-judgmental discussions surrounding the important topic of mental health in Australia. With the theme being Mental Health Matters, the awareness is cumulative. In 30 events we have organised to reach the community in all mental health subject matters affecting our lives today. To further continue our journey of 1,000 miles, the Walk for Mental Health has transitioned from a Victoria-only walk to being a nationwide community walk, where anybody from anywhere in Australia can connect with us, walk with us virtually to spread the impact and awareness of mental health. We pride ourselves with making sure all our programs are for the community and are powered by the community. We have a vast growing network of multicultural ambassadors who are part of our program to further the community voice in promoting positive mental health and wellbeing. Our multicultural network has inspired our educational and multicultural webinars as an initiative to help power multicultural ambassador. It has promoted one vision, which is to serve others before self during this time of uncertainty. Foundation to continue this success. as we
Thank you. We'd now like to invite Martin Kravosha, Chair of the Youth Ambassador Program with the Mental Health Foundation Australia. Martin is a lawyer, currently working in civil litigation and insurance law. Having also worked in a number of industries, including volunteering at a family education and support not-for-profit, Martin has experience communicating and interacting with people from all walks of life. During this time, he has developed a keen interest in the Mental Health Foundation Australia and its initiatives. In his free time, Martin has various hobbies, endeavours, including computer programming, camping and sport. Now I'll invite Martin to provide a welcome address to our attendees and our speakers. Thank you.
Thank you, Pantelis. Hello, everyone. My name is Martin Kravosha, Chair of the Youth Ambassador Program here at the Mental Health Foundation. On behalf of the Foundation's Youth Ambassadors, I'd like to take this opportunity to extend a warm welcome to all of you for joining us today for this great conference. The Youth Ambassador Program is open to all members of the community within the ages of 16 and 25 and aims to create, support and implement mental health initiatives for the youth of Australia. Now, for today's speakers, I thank and welcome Mike Hutton-Squire from Australian Unity, Vic Health, Professor Peter Barlas, Ron Gennon and Tom Buckholt. As mentioned by Pantelis, on Saturday we launched the Youth Mental Health Policy Paper. This paper arises out of the 2018 Youth Mental Health Conference, which involved discussions and workshops with Australians' young people. The paper really covers a range of topics, including depression, anxiety and panic disorder, eating disorders, adjustment disorders, along with a number of other key challenges faced by Australian youth. I want to thank Ron Gennon and Tom Buckholt for co-authoring the paper, along with the numerous youth ambassadors that contributed. I'm looking forward to yet another Mental Health Month event today, and thank you all for coming along.
Okay, hi everybody. Martin, thank you for your introduction, and thank you for all the good work that you and the youth ambassadors do. It is really great work. So my thanks to all of you, and I look forward to reading that paper that you mentioned with some interest. So good afternoon, everyone. My sincerest welcome to everyone who's joined us today on this important topic of youth mental health. And I'd like to start by acknowledging the traditional owners on the various lands on which we meet today, and pay my respects to their elders past and present. I'd also like to offer my condolences to all of those who have lost family through the COVID-19 pandemic. My thoughts and support certainly go out to those people affected. So for those of you who don't know me, my name is Mike Hutton-Squire. I'm the Executive General Manager of the Health Services Division of Australian Unity. I also want to acknowledge the work that the Mental Health Foundation Australia does and their great work in the mental health space. This is Australian Unity's second year of involvement with the foundation, and we look forward to really tackling some of the most challenging social issues together. Mental Health Month is, as you know, held in October each year, and it gives us the opportunity to raise awareness about mental health and well-being. It's a chance to promote activities and ideas and that can have a really positive impact on our daily lives and of the lives of others. Today, I've been asked to speak with you about youth mental health. It's a subject very close to my heart, as I have lived experience with a teenager who has unfortunately spent considerable time in hospital this year with his own mental health challenges. And in particular, this year has been perhaps the most challenging. Over and above the severe economic impact that's been felt by the pandemic, it's perhaps the mental health impact that will be felt much greater and for much longer as our young people overcome what has occurred in 2020. The Centre for Multicultural Youth recently launched a report into the key issues for multicultural youth during the pandemic. It noted that in young people from diverse backgrounds, 85% currently felt worried, and 75% said that they had felt sad, depressed, or unhappy. But also, interestingly, the well-funded services like phone hotlines or traditional mental health services are not always being accessed by the sampled youth because of the perception that these services are perhaps for those with either a pre-existing diagnosed mental health condition, or that they're not culturally tailored to understand the core issues of immigration, racism, and even digital literacy. So therefore, the need for bicultural and community-driven solutions has never been stronger. Recently, there's been some much welcomed investment in mental health, as announced through the budget last week. Much has been said of the need for increased investment, but also of increased reform of the mental health sector. And so, like many of us, I eagerly look forward to the release of the Productivity Commission's final report into how we can optimize services, because it would seem that at the current rate of spend, utilization, and unmet need, that we find ourselves in a fundamentally unsustainable position. So whilst more money for services is commendable, it doesn't necessarily increase the supply of mental health professionals that's needed to meet this demand, as it takes at least 6 years to fully train a psychologist, and it takes many more years to train a psychiatrist. So the supply and demand equation is somewhat out of balance. We have a severe shortage of workforce to meet these needs that funding alone won't solve. In particular, workforce that is trained in cultural awareness and specific areas of need for young people from diverse backgrounds. We have to do more to look after our youth now more than ever. And while the pandemic impacts school attendance, another byproduct is emerging for our youth. Cyberbullying has also reportedly increased by 70% this year. In my career, I've worked extensively in the technology and digital space. And while our technology and communication has made everything so much more accessible and immediate, like working and schooling from home, we've seen the proliferation of digital channels now means bullying can extend anytime, anywhere, outside school hours, into home and personal lives, and can have a substantial impact on absenteeism. And as we now look forward to returning to universities and schools, for young Australians, these places are the place for academic, social, and cultural engagement. It's where we learn skills for our future careers. It's where we spend time with our mates and where we can learn about our local and global environment. As such, schools and unis should be safe and encouraging environments where we can do all this. And there is growing understanding that if the educators are more aware of the link between increased absenteeism and diminishing mental health, more can be done to intervene and provide treatment. Assisting students to address mental health and well-being may in turn help prevent the emergence of chronic absenteeism. At the same time, working to help students who are showing signs of chronic absenteeism attend their place of learning consistently may also prevent ill mental health and poor well-being, both now and into the future. And it is so important for you as the future generation of leaders to keep having these conversations between yourselves, your educators, family, and the support mechanisms where you can. There is also more work we need to do to close the gap between Indigenous and non-Indigenous Australians and improve mental health and well-being of all Aboriginal and Torres Strait Islander Australians. Aboriginal youth experience a suicide rate that is double the non-Indigenous rate. And so as a nation, we need to improve our efforts to address these inequalities and not just close the gap, but exceed the gap. For a long time, Australian Unity has recognised the importance of high-quality mental health support services. In 2015, after we conducted a global search, we adopted the UK's National Health Service model of low-intensity behavioural therapy. We worked with Flinders University out of South Australia to contextualise it to Australia and adapted it for more acute clients, as we knew that most people who would enter our program would have recently been discharged from a hospital. So certainly presenting with more severe symptoms. The program is directly addressing the challenges with increased healthcare utilisation by enabling people to recover from anxiety and depression in their own home and stay recovered. Results from our service have shown encouraging results and have been published in a peer-reviewed journal as evidence that nearly 6 out of 10 participants recover from their anxiety or depression. The MindStep program's evidence of success is important in the Australian healthcare context to provide the linkage between primary care and acute care. A national model of stepped care between the various settings is needed to ensure Australians don't bounce in and out of the healthcare system but that they develop skills for self-management of their mental health that can last their lifetime. The MindStep program can train qualified mental health coaches in as little as 12 weeks and have them operating at a full caseload within 6 months. This ensures we're able to rapidly scale the mental health workforce and ensure more people can access care quickly. Furthermore, lived experience and evidence-based interventions are crucial in ensuring public and private health dollars are appropriately utilised and that we remove any care that's effectively low value. Australian Unity is demonstrating its ongoing commitment to the mental health and well-being of Aboriginal Australians and communities through the recent investment into the development of a variant of our program called Healing Minds. This is an initiative that's jointly developed by Australian Unity's Indigenous Services and Remedy Healthcare divisions, and it leverages our existing experience in mental health services and Aboriginal care. We established the Indigenous Services business in 2018 to provide culturally appropriate care and to develop improved services for Aboriginal and Torres Strait Islanders. The Healing Minds program commenced in July 2020 and will be rigorously analysed with Flinders University to determine the improvements it is delivering for Indigenous people. We also plan to adapt the program for culturally and linguistically diverse communities and to respond to the growing needs for mental health support that are proven to work. And so, Martin, in closing, Mental Health Month is an important opportunity to raise awareness about the impacts of mental ill health and the range of supports available that can improve someone's sense of well-being. I am personally committed to ensuring that we develop and continue to innovate new ways for people to access and receive effective treatments that work to alleviate their mental health symptoms. This is especially true for culturally and linguistically diverse communities and Indigenous communities who we know are at higher risk for mental health concerns. It's important to acknowledge the important role schools and universities have in the prevention of declining mental health, as well as being important partners with students and parents in responding to these occurrences. Together, we can all play a vital role in building and promoting positive mental health strategies in our communities. And I encourage you as students and the future generation of leaders to start, engage, and contribute with these conversations. We must maintain a focus on services that are grounded in evidence and have long-lasting, meaningful impact to people's mental health. I'd like to thank the Mental Health Foundation for their unwavering commitment to improving better mental health for all Australians. Thank you.
That was Mike Squire, Executive General Manager of Health Services at Australian Unity. Thank you for your address, and thank you to Australian Unity for the continued support of National Mental Health Month and the Foundation's numerous activities. I'd now like to introduce Irene Verens, Manager of Mental Wellbeing at Vic Health. Irene has a 20-year background in the program, design and management of community-based initiatives within education, local government, the arts and the workplace. Irene is also responsible for the Workforce Development Program at Vic Health, which is designed and delivered across Australia and internationally. Irene has presented and published in the areas of mental health promotion, social determinants of health, and workplace development. Irene is a member of the Australia
Hi everyone. Are you able to hear me? Great. Thanks for the chats. Thank you. Okay, welcome everybody. I'm really honoured to be here and thank the Mental Health Foundation for the fantastic work that they're doing. I too would like to acknowledge the traditional owners of the land upon which I am today, the Boon Wurrung in Victoria, and pay my respects to elders past, present and emerging. And I'd like to speak briefly to the importance of two things today. Thank you for the first PowerPoint. The first issue I'd like to talk about is a focus on the prevention of modifiable mental health conditions. That means really stopping them before they begin or making those mental health conditions that are very serious easier to live with. The second issue I'd like to talk about is the latest evidence that Vic Health has developed with others, and really the importance of evidence in the world of prevention and promotion of mental health. Could you have the next slide, please? Thank you. Okay, so recently, only a few months ago, Vic Health published the Vic Health Wellbeing Impact Survey that you can see on the screen at the moment. This survey was involved 2,000 people from the ages of 18 to 65, and what it found was 1 in 4 Victorians did not feel connected with each other. That was an increase from 1 in 10 figures in February. This survey was done in July. 37% of Victorians exercised less or were involved in less physical activity, and 17% were worried about having enough money to buy food. For young people who were involved, that's the 18 to 25-year-olds, the data was even worse. Next PowerPoint, please. In 2020, Vic Health also conducted an evidence review, finding that 21% of the burden of disability and death linked to some mental health conditions is preventable. So when something's preventable, we actually look at risk factors and how to decrease those risk factors and how to increase protective factors. The survey, the evidence review also found that risk factors included issues such as child maltreatment, family violence, bullying, as Mike mentioned earlier, racism, loneliness, and disadvantage. All of those factors contributed to poorer mental health in all communities. Primary prevention has to occur in a range of settings in which we live, work, learn, play, and age. It isn't isolated. It has to be integral to our lives and every part and sector of the lives that we lead. Next slide, please. We know that because large numbers of mental health conditions commence early in childhood and adolescence and emerging adulthood up until 25, we have to intervene earlier. The evidence of what works is key to this intervention, alongside health equity or fairness, inclusion, and creating opportunities for everyone to have access to mental health services, support, but also before that, equal opportunity to educational opportunities, to work and employment and income, and also opportunities to have safe shelter and appropriate housing. The evidence review of what works for us was very much something based on international evidence. And if you'd like to access the evidence review, it's there in the link below. It's also on the Vic Health website. Can we have the next PowerPoint, please? So finally, Vic Health has a grant round, which I'd like to talk about, based on the evidence and also focused on prevention, which is really about addressing the issues that we've talked about very briefly today. Social connection, increased physical activity, increased capacity for security and equity, and increased ability to put food on the table for people. If anyone who's listening today is interested in the grant applications, you can go to the Vic Health website. The link is also on this PowerPoint. As it says, the applications close on the 27th, but it only takes 30 minutes to apply. You do have to be an organisation to apply, but the more applications we get that are informed by young people's opinions, experiences and solutions, the better the evidence around what works for young people's mental wellbeing will have. So thanks again to the Mental Health Foundation for allowing Vic Health to be involved in this Mental Health Month, and thank you very much again for your time today, and good luck with it. Thank you.
Thank you, Irene. So that was Irene Verens on behalf of a great supporter of ours, Vic Health. So thank you, Irene, for that address. Now it is an honour to introduce Professor Peter Barlas. Peter is an internationally recognised interventional cardiologist with Northern and St Vincent Hospitals in Victoria, and the Professor of Medicine with the Faculty of Medicine, Dentistry and Health Sciences at the University of Melbourne. After graduating from University of Melbourne, he completed cardiology training in Austin Health, followed by a Master of Public Health with Monash University. In 2006, he secured a fellowship and scholarship at the prestigious Royal Brompton Hospital in London, and then completed his PhD at the Thorax Centre, Erasmus University in the Netherlands, on the use of optical coherence tomography in cardiology. OCT harnesses the properties of infrared light to look inside blood vessels in ultra-high resolution. Peter has since overseen OCT's uptake across the region, with over 60 centres in Australia and New Zealand benefiting from his foresight. Peter Barlas is also a director with the Mental Health Foundation Australia, and is now an honour. And please welcome Professor Peter Barlas. Thank you.
Thank you very much, Pantelis, for that warm introduction, and it's an honour to be here. And again, I also acknowledge the land of the traditional owners for which we are all based. Now, again, I'm honoured to be invited to this forum, and also privileged to be a board member of the Mental Health Foundation Australia. So I'm going to just start sharing my screen, and hopefully you'll get to see some of my slides that I'm presenting. So I'm hopeful that you can see my slides here. So as Pantelis said, I am a cardiologist, so you might think what is related, how do we relate the brain and the heart? And the heart is obviously an amazing, amazing organ that pumps in our body at 70 times per minute. And when I started off as a cardiologist, I thought that the heart was purely the only most important organ in our body. But more and more over the years, and also my work with Mental Health Foundation Australia, I've become to realise that no doubt the mind is probably the most powerful organ we have in our body. And obviously without a mind, the heart cannot function. So I think both go hand in hand together. And again, it's an amazing organ that obviously does so much, and we don't really notice it when everything's working very well. You know, when the heart's pumping and working well, there is no issue whatsoever. However, when things do fail, there are problems that can develop, and I want to highlight some of those issues. So cardiovascular disease is a major burden we know in our community, and no doubt it still represents the leading cause of death and disability. We acknowledge that most often heart disease is a chronic condition, and there are several risk factors that have been linked to cardiovascular disease, including diabetes, high blood pressure, high cholesterol, smoking, and family history or genetic predisposition. So what, in essence, heart disease is a buildup of fatty deposits or plaque within the arteries of our body. And this process is known as atherosclerosis, and that causes a reduction in blood flow to our heart. And as this worsens, symptoms can develop. Now, my role, and I wear several hats, as you know, but I work as an interventional cardiologist, which is a severe episode of chest pain with a heart attack. I go in and I actually treat the blockage, and there is a bit of cholesterol in an artery. I've passed the wire through the wrist artery, and it's all done just with X-ray. There's no incisions or anything that I do. And I'm able to put some tools in there to restore blood flow, and put these little devices called stents, which act as springs to open up an artery and improve the blood flow. So that's, you know, what I do. And that's a very, very rewarding thing. This is all occurring between the hours of 12 midnight and 8 a.m. So you can imagine it certainly gives you a buzz when you go in and do this, but the most rewarding aspect is once the patient improves and settles down, it's an amazing, amazing feeling for me as well, and also the staff that are in there performing this procedure. But there is a strong link, obviously, with cardiovascular disease and our mental health. We know that cardiovascular disease is more common in those people living with depression compared to the general population. We know also that depression is a considerable risk for developing coronary artery disease, along with other risk factors such as smoking, high cholesterol, and high blood pressure. Less is known, however, about the links between anxiety and heart disease, but we know that many people with anxiety also suffer symptoms of depression as well. Depression is also linked to other known risk factors. So when we don't have an elevated mood, where we feel very low, when we are, not communicating with our loved ones, when we're withdrawn, there is a high tendency to participate in more unhealthy lifestyles and unhealthy behaviours, more alcohol consumption, more smoking. And these are critical factors that we need to be thinking of when we're not only tackling with the mental health issues, but also the physical and the implications on heart health. Depression is also common amongst people with heart disease, and obviously you recover after a heart attack, but what impact does it have on your lifelong well-being and your workplace? And how are you feeling about your future? There are concerns, there are questions that are always raised. Am I likely to suffer another event? Am I going to have another heart attack? Am I going to be around to enjoy my children? All these questions contain and bring on significant anxiety and further compound the issues of mental health. We know that motivation is lacking. When there is an element of depression or anxiety, our motivation is lacking. We may not pay attention to all of what are the key requirements for optimal heart health, namely exercising, namely adhering to a proper diet, but also drinking and alcohol and smoking, unfortunately, are ongoing issues. Now, our fears and anxieties can have a significant impact on our heart, and I've seen it firsthand, particularly during this COVID pandemic. You know, I've had patients who unfortunately have been sort of in their 20s and 30s who have actually put up with symptoms for several days, even a week, because of the actual real fear of contracting COVID when they go into hospital. So this fear, these anxieties are not only chronic symptoms and have chronic impact, but they also are very real in the current pandemic that we find ourselves now. And they are leading to, unfortunately, worse outcomes with patients not coming into hospital to seek care sooner. And again, the issues of substance abuse becomes very paramount during these times, with increasing stress, anxiety, increasing issues of financial heartache, loss of employment. We're seeing a rise in substance abuse, and that also has implications on the heart's arteries, the heart muscle, but also the valves of the heart, where they are prone to infections, for example, in intravenous drug use. So obviously the heart plays a critical role in our body, and you can imagine that when something goes wrong in our body, in any other organ, it will have an impact on the heart in some way or another. Our heart, obviously, at times of anxiety and stress, has to work harder. So we have a higher heart rate. Our heart rate increases, that therefore increases our blood pressure. And these are often transient or temporary conditions. But again, there are those sufferers who continue to have these symptoms day in, day out, who unfortunately do have a high incidence of developing heart issues, and therefore we do need to intervene. Now, what are the symptoms? And I see a lot of these patients. I see a lot of patients who come to me with these symptoms, fearing the worst, fearing a major concern, a major problem with their heart. The heart is racing. Doctor, my heart's jumping around. I can't sleep. My heart is racing and it's fluttering. It's skipping beats. Or, doc, I can't catch my breath. I'm having chest pains, doc. Am I having a heart attack? Then there are also the symptoms that are noticed by the family and the loved ones around the network there. Irritability, moodiness, a change in behaviour. Then other physical symptoms can manifest of increasing sweating, feeling tired, feeling sick, weight going up or down. These are real symptoms that we do see with mental health and mental illness, but also that we see with heart disease. So you can see my interest and my passion in marrying what happens in the brain with the heart. And without that understanding, I don't believe you could become a proper cardiologist. So these physiological changes of higher heart rate, higher blood pressure do impact our mental health and well-being. And therefore, it is important to seek advice and to further assess these symptoms with your local physician, your local general practitioner, to get an assessment of what these symptoms are all about. I like to teach my students and the medical students and the training doctors that you never put anything down to anxiety first up. You really, really must investigate to ensure that you've ruled out an underlying pathological process. And that will give the patient immense satisfaction and relief once they know that everything is working well and it's not a physical problem with their heart. So we explore the heart, we do some preliminary tests, but again, once we've done the tests, the power there of the general practitioner and the cardiologist is to be able to offer reassurance, to reassure you that these symptoms are not related to an actual physical condition, but manifest purely because of the disorder occurring in the brain as a result of anxiety, as a result of depression that is putting more stress on the body. And treating these conditions, these underlying conditions, has a profound impact on improving quality of life. But there are also other areas that we need to monitor very, very closely. In some patients who might have eating disorders, we know that there can be problems with their electrolyte levels in their blood. We need to monitor that closely. There are medications, and I get to monitor a lot of patients who are on medications for mental health reasons. And there are some potential issues that can affect the heart. So we need to be carefully monitoring the heart and how it's performing. But very, very good to see that the majority of patients who are on therapies for many, many years can live normal, active life without any heart issues. And that's a great, again, a very, very reassuring part of my job. So how do we tackle symptoms? And I've got a long list here. Obviously, many things we can do, but one thing that we often ignore, and a lot of my patients ignore, is number one, is drinking enough water. It's amazing that when we don't drink enough water, we have a lot of caffeinated soft drinks, a lot of stimulant drinks to get us going, Red Bull and whatever they call them nowadays, but we're out there drinking these to keep us alert, keep us engaged in society. Well, they all have an impact. All these medications, all these caffeinated drinks have a diuretic effect on the body where we lose a lot of fluid. A lower level of fluid tends to cause our blood pressure to fluctuate, can cause a lower blood pressure, can cause the heart to palpitate, to get fluttered. So very, very important we address fluid intake, but obviously exercising, eating healthily, reducing alcohol, and looking at smoking cessation. And again, linking up with your GP, with a psychologist, with your therapist to look at how we can tackle this. The Heart Foundation has got a wonderful resource on their website to look at, what are the options? Where can you go for help? There are many, many avenues, but starting off with your local doctor is probably the best bet there. Or your therapist, your psychologist, psychiatrist, and they will be able to steer you in the right direction. There are several helplines that are also available, but also on the Mental Health Foundation Australia website as well, to guide you into where help is available in times of need. As an educational initiative, what I've recently been involved with is one called this Heart Matters channel. And again, it's something that's only in its infancy, but feel free to log on on the website, subscribe, because it will be a general resource for information that's kept simple about heart health and how do we optimize heart well-being. So again, another little resource there. So again, just to finish up, when things do appear to be in despair with no solution in sight, I always like to sort of see that there is a light at the end, and there's always a way to make things better and to always be positive about what the outcome will be, irrespective of how bad things seem they are at this point in time. There's always somewhere and people that can help you to get to a better place. Thank you very much.
Thank you, Professor Peter Barlas, for that address, and thank you for your continued support of the Foundation in providing your many addresses and advice into the many activities of the Foundation. So thank you very much. I'll now like to introduce our Youth Ambassador Program Vice Chairperson, Ron Gedden, who will now be providing an address on the Mental Health Foundation Australia's Youth Policy Paper. Over the past 2 years, the Mental Health Foundation Australia has been working on its policy paper into youth mental health. Central to this has been the paper's author, Ron Gennon, who alongside co-author Tom Buchholz have been using contributions from young Australians to provide policy solutions to address shortfalls in the area of youth mental health. Ron first took on this project as a Mental Health Foundation's project officer in 2019, before becoming vice chairperson of the Youth Ambassadors program in 2020. Let's welcome Ron Gennon to provide this address.
Good afternoon, ladies and gentlemen. My name is Ron Gennon, co-author of the Youth Mental Health and Wellbeing Policy Recommendations. Before I begin, I'd like to acknowledge at this event. Firstly, I'd like to acknowledge Professor Peter Barlas, cardiologist and director at MHFA, Miss Irene Verens, manager of mental and Vic Health, and Mike Hutton-Squire, executive general manager of health services at Australian Unity. In 2018, the Mental Health Foundation Australia began a 2-year process of documenting the mental health experiences of young Australians. We decided to undertake this process in order to understand where shortfalls in the mental health services provided to young Australians were present, but also to formulate recommendations of our own to improve mental health outcomes. This coincided with our goal in connecting with younger Australians directly and collaboratively working with this demographic to provide better tailored mental health services in schools and tertiary institutions. In that same year, the Mental Health Foundation Australia conducted its inaugural Youth Mental Health and Wellbeing Conference during Victoria Mental Health Month. This conference provided direct opportunity for young people to detail their experiences with mental illness and with the mental health system through 9 separate workshops, each focusing on a separate mental illness. It was from this conference that the Mental Health Foundation Australia decided to collate all the feedback received into policy recommendations. The aim of these recommendations was to inform lawmakers, academics, and wider mental health sector of the direct experiences of young Australians, but also provide tangible and well-researched recommendations to fix perceived shortfalls in the youth mental health services. The paper was also framed around the key points from the terms of reference of the ongoing Royal Commission into Victoria's mental health system. Further feedback and contribution were sought in 2020 from our youth ambassadors, especially in the light of the events of the last 6 months. These contributors in their own time provided thoughtful and insightful contributions that refined and added onto the body of work we'd already had from the 2018 conference. Contributions were sought for topics including depression, anxiety, panic, eating and adjustment disorders, gender identity issues, generational trauma and stress, obsessive compulsive disorder, psychotic disorders, and substance abuse and addiction. Often contributions came in the form of personal lived experiences, detailed analysis of approaches to helping those with a particular condition, as well as a breakdown of societal barriers and stigma relating to a particular illness. Key takeaways from the contributions received from the 2018 conference and the 2020 ambassadors include the need for greater capacity within the mental health services inside tertiary institutions, the need to further educate many young people so the symptoms involved with depression and anxiety, how mindfulness and anxiety management apps are increasingly being used as methods of coping with anxiety and panic disorders, how media has misrepresented and mischaracterized eating disorders, the need for more programs to assist with the transition from school to university, greater support services available to those struggling to cope with the stigma associated with their sexual identity, how compassion towards those with OCD will go a long way to helping sufferers cope, the need for more mental health first aid trained individuals inside our educational establishments and workplaces, the need for more mental health, and finally, the need to look overseas for better approaches when it comes to how we treat those struggling with substance abuse and addiction. As a result of these contributions received, the MHFA has come up with 4 key policy recommendations it believes need to be implemented in order to improve mental health outcomes among young Australians. These include the introduction of compulsory mental health units in the first year of study for all students transitioning out of school and into tertiary education. The need to hire an increased number of clinical psychologists inside universities and TAFE colleges in order to meet growing demand. Further resources being dedicated towards expanding university job assistance programs, and the need for capital city drop-in centres specialising in youth mental health that can reduce the stress on existing university mental health services. Just before I conclude, I'd like to acknowledge the following individuals for their work in making this policy making this policy paper a reality. I'd like to acknowledge my fellow co-author, Tom Buchholz, for his assistance editing and refining this paper, but especially for organising further contributions from the 2020 Youth Ambassadors. I'd like to thank both the staff at the Mental Health Foundation Australia and its chairperson, Vasan Srinivasan, for the assistance and support they've provided Tom and myself throughout the whole process. I'd like to also thank our patron, Professor Bruce Tong, and Vice Chairperson Jim Gooden for their work reviewing the contents of the paper. I'd like to thank the MHFA's two respective youth chairs, Alexander Lissov and Martin Krasovia, for their support throughout. Finally, I'd like to thank the contributors from the 2020 Youth Ambassadors, who in their own time presented well-researched and insightful contributions on which many of our recommendations were formulated from. Thank you.
Thank you, Ron, for providing that address on a very important policy paper that will go towards forming policy at all levels of government, and both in government and the corporate sphere. I'd now like to invite again Professor Peter Barlas and Martin Krivosha, as well as also inviting Thomas Buchholz, the co-author of the youth policy paper. Throughout this year, Tom has co-authored the policy paper as Secretary of the Mental Health Foundation Australia's Youth Ambassador Program. This included writing the final draft after seeking contributions from the Youth Committee members, detailing personal experiences and academic research of mental health issues affecting young people. Please welcome these three fantastic speakers for a panel discussion. Any questions you may have, please submit them into the Q&A section at the bottom of your screen, and they will be answered by the panel. Thank you.
Well, thank you very much, Pantelis. Can you hear me, by the way? Is my microphone working?
Yeah.
Okay, great. Good. Just before we get questions, I just want to thank the contributors who spent their time helping us and adding to the content of the policy paper. Tegan Avery, Matthew Kasoglu, Alexander Lissov, Wasana Lianaga, Prachi Mehta, Mark Moranti, and Elizabeth Tilantello. Clearly, they're very motivated to progress the policies of mental health, and that's pretty much all that they were expecting to do here. And so for that, I think, I'd like to express, on behalf of myself and Ron, a very sincere gratitude to them.
Can I also just say that going through that paper, I must congratulate you all, because it's an amazing document that has actually put things, look, in a very powerful way, and I think really hones in on the issues that our youth are confronting. As I mentioned in my talk, these are ongoing issues: spectrum of anxiety, depression, eating disorders, gender issues and identity disorders. All these conditions have a major bearing on our health and well-being. And again, I get to see it from a cardiology viewpoint, whereby a lot of these conditions and syndromes and do manifest and do get referred to a cardiologist. And I think the key thing there is to actually work with the patients rather than labeling a patient, and that's what's happened in the past, unfortunately, with mental health and mental illness. We have been stigmatized, and that makes it more challenging to actually treat. But I think the great work that the team is all doing here in the Youth Ambassador Program, again, I must congratulate you, because you are making a huge impact on reducing the burden, reducing the stigma, to make it more socially acceptable to seek help when something's not going right. And just a big congratulations.
Well, thank you very much, Peter. From you, that's very high praise.
Thank you. I think we have some questions in the Q&A. First one to Professor Barlas. What has inspired you to become a cardiologist? And do you think that society should become more aware of the mental health issues that can have a bigger impact on heart and overall health?
Look, thank you, Martin. Look, as a cardiologist, yeah. Look, I always, as I said, I always wanted to be a doctor, and I must say, I I like many of you know, I've not led a privileged life. You know, I went to public schooling all my life, and I worked hard. I had migrant parents from a Greek background, and I knew the struggles, and I saw how challenging it was for my parents who worked in factories to give myself an education and to allow me the opportunities, and growing up, and I guess perhaps a lot of the role models, in addition to my family, my parents, happened to be my family GP. And my family GP, I remember him as a very elderly gentleman who was so attentive to me every time I would go there. It made me feel at ease, made me feel comfortable, made me feel not afraid. And that really was perhaps one of the most pivotal, inspirational moments in my career. And then I trained off into high school and then university, and I had this notion of wanting to be a doctor. And then I got to do a lot of work with engineering, and engineers in the UK where I worked, we were focusing on how the influence of aerodynamics, or how planes go up in the sky. And we were using those principles of flight to how blood flows in the vessels, and how blood can flow down a lake or a river, and it causes turbulence. And that turbulence, unfortunately, in the arteries of patients can actually cause heart attacks or cause clots to build up. So that whole engineering and the mathematical aspects of it made me really hone in on focusing on the heart as what I wanted to do. The heart is an amazing piece of machinery, I see it. It really is an amazing organ. But unfortunately, a lot of my colleagues do not understand the link between the heart and the mind. And I think, as the question rightly points out, it is important that we focus not only on the heart in isolation and focus on the symptoms that the heart presents with, but look at what context are those symptoms happening in. And most likely and more likely, we find that mental health and mental illness is a major factor in driving a lot of the symptoms that we see. So that's really a little journey of where I sort of started and how I've got to this point in my career.
Thank you for that, Professor. I think it really is quite important to now really understand the link that mental health can have to physical illness, and what we can do to improve that as treatment for physical illness and as prevention.
Absolutely, mate. I mean, it's an enormous problem. And again, the other aspect is the medication that are often used. And, you know, there's a lot of medications that in some individuals are required to treat mental illness. But it's important to monitor these medications. And again, look at trying to ensure that you're having your checkup with your doctor. Don't miss these appointments. Please don't miss them. I can say to you, look, it's very important. Go and have a 5-minute chat with the GP. Have the blood pressure monitored just to make sure that the blood pressure is staying stable. And again, these are simple things that we can do that only take a little minute of our time, a few minutes of our time, but make huge impact into improving our heart health long term.
Important advice. So I think we have a question for Tom in regards to the policy paper. How does the paper work to address stigma around mental health issues in our youth community?
Well, that's I think a fantastic question to start on regarding the paper, actually, because we do talk about stigma several times throughout the paper. And I think, first of all, just the effect of the paper itself on whoever would be reading it, where we're putting the people's experiences of mental health and the conditions that they've faced front and center. And so I think what it really does is really empowers those experiences, normalizes them especially, and when these things become more normal, it becomes more easy to talk about. It certainly becomes a lot more easy for people to accept mental health problems for themselves or for their friends and family, and then much easier to talk about them. So I think just the paper itself, even if it's just a small effect it has on that, would be really positive. And then also what we want other stakeholders to do, if we're going to influence other people from this policy paper. For one example I would give is particularly with universities and TAFE as well. One of the main things that we want is for universities to have a compulsory subject at the start of a course where students have to go through some mental health education and understand what the services are and understand some common mental health issues. And so we think, making that normalized by the universities would go a long way to reducing the stigma that mental health issues have.
Perfect. And I guess it's all about education and then access to support
Awareness.
and awareness, right? Now, in terms of, there's a few people asking about accessing the paper itself. Do you want to speak briefly about where people will be able to access it?
I'm not entirely sure. I think it's being released very soon. I'd have to speak to Pantelis about that. I'm very sorry.
I'd imagine we'll probably put a message out
Yeah.
to the greater community about.
I'm sure it'll be very public.
Yeah, perfect. And we can hopefully get some more questions coming through.
I think, can I just add also, Tom, that's a great comments you made there. I mean, the stigma is important here, and I think we have to break down those boundaries. What I like to, how I like to describe it to my patients is when they, when we're talking about the impact of mental illness, we often don't see it as a physical problem. Look at something in the mind. But interestingly, the way I like to say it to my patients is, look, you cut your finger, it will bleed. It will cause, it's a physical problem. You'll see the bleeding. But unfortunately with mental illness, we don't see that. We don't sort of see what is the outcome, and it's just a clouded feeling in our mind, sometimes of confusion, of worry, of stress, of anxiety. But I like to tell them that, in fact, when you bleed, the bleeding causes problems. When you cut yourself, it causes changes in your hormones. Equally with mental illness, we are experiencing profound changes in our hormones, and it's a hormonal imbalance. There are several neurotransmitters that have been linked to anxiety, depression, dopamine, for example, and all these hormones are changing. So it is actually a physical condition, a physical change in our body. And that sometimes just makes it a little bit more acceptable to patients to think about, well, that's a nice way to put it, and that's actually the real way. So treating you for it with psychotherapy, with psychological help, with medication can actually help to restore some of the natural balance. So I think it's important that we try to keep on breaking down this stigma, that it's just in the mind, nothing physically is happening, it's all in the imagination. It's
Absolutely.
not beyond that.
It's not. There's no. If you break your finger, there's no stigma for that. So why should there be a stigma for mental issues? Absolutely.
Spot on, Tom. Spot on.
In terms of the paper as an author, Tom, what was your key takeaway from it?
Yeah, I saw that question there. That's look, I'd say the key takeaway I would take away is that the contributors, who are completely volunteers, are very talented and very knowledgeable in the sphere of mental health, and a lot of them, I won't say who, but a lot of them spoke from their own personal experiences, and some were assessing the experiences that they sort of experienced secondhand with their parents or friends. But they were also able to assess these things from an academic perspective as well, looking at examples from other countries, looking at how there have been changes in how mental health has been treated in Australia. And so I would say that if you only took one thing away from this paper, it's that young people, particularly those who have experienced mental health issues, have a lot to say, and very clever things to say about mental health and about policies that governments and institutions like schools can do.
Perhaps for Professor Ballas, how prevalent is the relationship between heart disease and mental illness? You've obviously described the links between it, but how often do you find this being an issue in your practice?
Look, I think the majority of patients that I deal with on a daily basis have some issues with respect to mental illness. Now, in the majority of those cases, it is often a very short-lived experience, transient. The initial worry of having a heart attack, surviving a heart attack, being rushed into hospital. What is the fear that someone feels? I mean, obviously it's an immense amount of anxiety. And through a lot of counselling and support and cardiac rehabilitation, which takes a big focus on how this condition has impacted one's mental health, the majority of patients recover completely, leading a normal, active life, back to work, back interacting with their families. But we can't ignore the small percentage of population that, unfortunately, who do have a heart condition continue to run into problems. And these are the patients that, you know, attention needs to be addressed. Not only dealing with the physical symptoms and the signs, the high blood pressure, the heart rate, but also the ongoing symptoms, the sleeplessness, the sleep deprivation, the impact that that has on the physical symptoms again. So they can't sleep, you know, patients can't sleep during the night. They wake up during the day, they're not feeling refreshed. They want to nap during the day, but then they have to go to work. How do they balance life? These are the things that you need to, and as I do as a clinician, as a cardiologist, I focus on the heart, but I like to spend probably a third of my consultation with the patient talking about them overall and how they're feeling and how they're managing and how they're coping. I think that's probably the most powerful message that I can give to my patients, is spending that bit of time with them rather than just focusing on your blood pressure's fine, off you go, see you in 6 months. How are you managing? How's work going? How's the home situation? Are you sleeping? These are the simple things that I've learned over, you know, years of experience that gets me a better understanding of my patients and therefore better outcomes.
That's really a holistic approach to health of the person.
Very, very important. Again, you know, I'm a cardiologist, a professor, you know, you can have whatever title you want in your life, but if you cannot have the holistic approach to a patient, an empathetic approach to understand the patient as a whole, you won't succeed.
Very good. We have a question about mental health of young people when they're entering the workspace, especially how management can consider people moving into the workspace and how to handle their mental health issues and challenges that they might be facing. I guess on my end, a quick note, I obviously went from high school straight into university for 5 to 6 years and then into the workforce. And I definitely noticed that at each transition, you're learning a bit more responsibility. You're given more freedom to make your own decisions. And with that comes stress, possible and anxiety. And I guess not being sure of how to conduct yourself, what you should be doing, and how to sort of put your best foot forward going from school to university, and then university, the big leap into the workplace. Perhaps Tom and even Professor Barlas, if you have some notes on this in terms of how management can aid young people in transitioning into the workplace.
Well, I mean, I can only speak from my experience as well. I mean, when I moved from high school to university, I knew nothing basically, and you know, I was pretty hopeless with all this freedom. So it was a struggle in terms of the transition. But if I look to a good example, so I work for a financial services firm, and I think they're very proactive with mental health as far as I can see. So they can do things like every month when I was starting out, we would have meetings with my manager, and you know, there'd be questions, and it's not just like, yeah, is everything okay? Because you know, you're new at a job, of course I'm going to say everything's okay, but instead what they're saying is, what are the actual issues? What are the roadblocks? What are the things that you wish were simpler in your transition? You know, I'm not too sure how to be more specific or what more I can say, but I think things along those lines are very positive steps that managers can take for the mental health of their employees.
Wonderful.
Look, Martin, I mean, I remember. Look, I mean, I've got 2 children at the moment, a 15-year-old son and a 10-year-old daughter, and I was telling them my experiences going in from high school to university, and I was lost, as Tom said. I found it very, very challenging, very, very difficult transition, because new people who I had not had connection with. You know, I had all my friends in high school. I'd been with most of them since primary school. So you can imagine that's, you know, 12 odd years of education and friendships. And I felt totally lost. I felt, look, how am I going to manage this? How am I going to cope with this? And not to also think of, you know, the added study and the complexity of the study was really, really a challenge. So I sort of led on to and relying on a lot of my friends back in high school. You know, although we separated in different streams, I still would go back to them for some sound advice and sort of what do I do and how do I manage this? But in terms of workplaces, yeah, I think workplaces are probably changing. I mean, probably slowly, but certain industries are changing and understanding that there is a big transition period for youth to come in from, say, a school into a workforce. And I think offering, as Tom said, some sort of support, whether it's information sessions, webinars, psychological support, counselling, but again, just a mere chance or the opportunity to express yourself in a non-judgmental way, in a way where you don't feel you're going to lose your job by actually acknowledging that there might be a concern, there might be a problem. And again, I think it just starts off with education, training employers to actually, you know, to set up these programs to ensure that the stigma goes away. You know, we're openly talking about how we're feeling. Our emotions are very, very important to express, and they are the biggest influencer of our long-term health and well-being. So that's got to change from an organisational viewpoint to get these into place to actually allow this adjustment, this change and transition to ensure that our youth can actually grow, develop, and become, you know, the mature adults that we all want them to be.
And I think that awareness is arising in the workplace where employees are able to talk about challenges that they're facing and not have to worry about losing their job or other workmates thinking bad things, or it's sort of being able to talk. And that's something that's being improved in school, in university, and I think now in the workplace.
Spot on. What you're saying is being able to talk, and that's what, you know, this forum is allowing us to do. And, you know, this is what the organisation is all about, the Mental Health Foundation, to bring these opportunities to actually express ourselves and to actually say that, look, this is normal. You know, the professor here, the big professor, went through the same things when he was going through his high school and training and in his early years. So it's absolutely all normal, and we should be encouraging all of us to be able to express ourselves. And have that awareness.
Normalization.
Normalization, spot on.
Okay, well, I guess we do have a lot of questions, but I think that's all we have time for today. I want to thank you both for being part of the Q&A session. And to
look, thank you. It's been an honour, and I must say, look, you know, if there's interest, I'm happy to jump online at another stage soon and
absolutely,
you know, continue on the discussion.
To you, Tom, thank you again. Firstly, for authoring the paper and also being a part of the discussion today.
Thank you very much, Martin and Peter. Thank you very much.
Thank you very much, Tom. Good on you, Martin. Thank you.
Thanks, guys.
Thank you, Professor Peter Barlas, Martin Kravosha, and Thomas Bullcolt for addressing and taking those questions, as well as Thomas, Martin, and all the team for all that hard work into the policy paper. This policy paper is a looking glass into youth mental health as created by conversations within the youth of Australia themselves. You'll soon be able to access a copy of this policy paper on our website, www.mhfa.org.au. So yes, you'll soon be able to access that. It has been launched and it will be ready soon. So thank you all for joining us today. If anything that was addressed was confronting for you, please know where there is help available. You can contact the MHFA Mental Health Helpline on 1300 MHF-AUS or 1300 643 287. Additionally, you can contact Lifeline on 131114. I'd like to thank all our speakers today, Martin Kravosha, Irene Verens, Mike Hutton-Squire, Professor Peter Barlas, Thomas Bullcolt, and Ron Gennon. As a gesture of our appreciation, we'll be sending you off this beautiful engraved pen on behalf of the foundation, on behalf of the board of directors, to express our gratitude. I'd like to also thank our sponsors, our National Mental Health Month sponsors, Australia Unity, Vic Health, the Department of Health and Human Services, I'd like to thank our youth ambassadors for the work they put into this policy paper. And I'd like to thank our volunteers and staff for helping bring this event together. Thank you to all attendees who have joined us via Zoom and via Facebook Live. And continue to keep in the loop, to check your emails for some future National Mental Health Month events, which will be continuing different aspects of mental health across the community and to address that mental health matters. Thank you for joining us.